Hello, everyone. This is Emily Youree with Fort Worth Moms, and we are having another Fort Worth Moms live panel discussion with local experts this afternoon. And I am delighted to give a Fort Worth Moms welcome to Mr. Vinny Taneja from the Public Health Department. He is the Public Health Director for Tarrant County, for our county, and he has graciously agreed to ask or to answer a lot of questions moms are asking. So thank you so very much for joining us today. We also have Dr. Bryan Youree, who is a local physician with the Texas Centers for Infectious Disease Associates. He is a local Fort Worth doctor, and we are very happy that he is here with us today too. And in full disclosure, just so we know, Emily Youree and Bryan Youree sound very similar, and you may be wondering if we are related. And the truth is we're actually married. So I'm going to refer to him as Bryan during our conversation, and Vinny has told me to call him Vinny. So I am, even though this feels a little weird to this Southern girl, but we're talking here as local friends, local Fort Worth residents, and talking about the pandemic issues that are happening here in our county. Because Bryan is my husband and is an infectious disease doctor, I've had a kind of behind the scenes perspective of everything that has been going on in the last year and a half. And I want to offer a personal thank you and a thank you from Fort Worth Moms to you, Vinny, to you, Bryan, to your staff, your support staff, all the healthcare workers that have had a grueling schedule, have had so many sacrifices in this last year and a half. Like, we heartily appreciate everything that you've done to keep our kids safe, our families safe, and our community as healthy as possible. So thank you for all that you have given to the greater good in the last year and a half. Okay, so let's dive into this. The purpose of this discussion is not for us to tell moms in Tarrant County like what they should or shouldn't do, or what choice that they should make for the schooling options that we have available. But it is to provide a really clear snapshot of what is not happening in the United States, not happening in Texas, maybe not even in North Texas, but what's happening right here in our backyard, in our very local community with the pandemic. And what are, like, just very clear and straightforward, what are the protocols? What are, like, the answers to these questions of what we do if our kids are not vaccinated, or we're vaccinated and they're not? And how do we handle sickness in school? So we're going to go into those questions, but knowing that we can't address like specific situations if those should appear in the comments. And we're not speaking to what your local school may or may not be doing. We don't know that information. I do want to say we are missing one panel member that we had wanted to include, and that is Dr. Whitworth, who is the medical director for the Infectious Disease Department at Cook Children's. So she could provide a pediatric viewpoint. However, she did answer the questions that we have, and I'm going to interject her answers kind of as we go along. I so appreciate her taking the time to send us her answers and for being a proponent for our kids in the community as well. So I have talked enough. All right, let's start with what Dr. Whitworth said when I asked her just to give us an overview of what she is actually seeing in the pediatric community. So what positive cases and what hospitalizations. And she told me that there is a definite increase in the number of pediatric COVID cases and in the number of children. So children hospitalized with COVID, those numbers are up, unfortunately. She said they are even comparable with the numbers, the hospital admissions for COVID that they saw in January. you two can correct me if I'm wrong, but we're looking at December and January as being kind of one of those mile markers of when it was the worst in terms of cases and hospitalizations. I'm going to start talking. Y'all answer that question.
I mean, for me personally, I think we're still kind of more like July of 2020 in terms of what we're seeing in the adult population. We're definitely not at the point where we were in January, where we were taking in patients from, all over Texas, as well as, Louisiana, Oklahoma, and we even had some patients from New Mexico at that time. So we're not seeing that at this point. However, we have had a very troubling increase in the number of patients, at least fourfold over the past few weeks, of number of COVID patients requiring hospitalization. And those, of course, are tilted towards younger patients that are unvaccinated.
Yes, and I will concur with you, Dr. Youree, that certainly we're not back in the spot where we were in January or end of December. Things were pretty bad, especially from a hospitalization standpoint. Hospitalizations, unfortunately, are increasing very rapidly, but we're still quite a ways away from what we saw in December, January. We're more like you said, what happened in last July. We're there pretty much. And as far as the pace of increase, it feels a little sharper than what we saw in last July. And then, of course, you can speak from a more in-hospital look, but just looking at the data across Tarrant County and all across North Texas and U.S. and everywhere, seems like there's a decided shift to a very young, healthy, generally healthy population. And that's where we're finding a lot of folks are, having that we're invincible syndrome and didn't get vaccinated, and now we have COVID. So there's decidedly a younger population getting impacted. Back in December, January, it was a lot of the seniors who were ending up in the hospitals and so forth. And now it's definitely a younger group. And there's a news story out today that last week in the US, there was a reported 32,000 pediatric cases of COVID. And this week it has jumped to about 72,000. So seeming like there's an increase happening with COVID in the pediatric population. But at home in Tarrant County, yes, we're seeing increases, not to that level, but there's a double header, RSV, respiratory syncytial virus. If you talk to any pediatrician, their offices are full. Hospitals have a lot of pediatric patients with RSV. So that's another issue that we're contending here locally in Tarrant County.
And we're seeing a lot of RSV even in adults, which is very uncommon. It's rare that we see that, but we have definitely seen that in rhinovirus as well, which complicates, diagnosis because, a lot of the symptoms can be very similar very early on in the illness.
Yeah, I think what you were saying is kind of reiterating what Dr. Whitworth was communicating, is that for them in the pediatric section, so that kind of younger population, and even a big part of that pediatric population doesn't even have the option to have a vaccine, is definitely seeing maybe a sharper, increase compared to their adult counterparts. Okay, so we have throughout this pandemic had a lot of recommendations about what you do if you have a symptom, what do you do if you have a vaccine? And so let's just go through that, because this is information that moms and dads need to know as they're going to navigate when kids need to be pulled from school. When do you get a test? So we're going to go very specifically and simply through this. And I have notes. I'm going to read it off so I don't mess it up. Okay, if you are not vaccinated, and this means whether you are 12 and older and just have not chosen to get the vaccine, or if you're under 12 and you can't get the vaccine. So if you are just not vaccinated, what can you do to limit your exposure and stay safe from catching that Delta variant that everyone is talking about? What would you say first to that?
Yeah, so let me try to address some of that. Delta variant, is again a mutated form of the COVID virus that we've been dealing with. And mutations happen. That's a normal part of life. I mean, it happens in our body with our cells. It happens with viruses. We see that happen every year with the flu. It mutates sometimes into a different strain. That's why every year we come up with these cool names, H1N1, H3N2, all of these fancy things to keep track of those mutations. And so is the same with COVID, that it mutates. The virus replicates really fast. So sometimes there's a glitch in the mechanism of replication, and that can lead to a mutation. Some mutations are good for the virus, where it spreads more easily, can be more virulent, and those are the mutations that survive, unfortunately. And some mutations can be bad for the virus. That strain just disappears, and those we don't see because nature takes care of that. So currently, what we're dealing with is a more infectious, more easily spread Delta variant of the virus. And, that's why you're seeing this sudden spike in cases. CDC director was out today talking about 93% of the cases that are occurring now in the US are the Delta variant. So it is the predominant strain. So it's fair to assume if you heard about somebody recently getting COVID, they probably have the Delta variant. You don't need to go checking every individual person, do you have Delta variant or not? It's fair assumption they've got it. So what can you do to protect yourself against the Delta variant? Now, again, it starts with if you're unvaccinated folks and you're eligible at 12 and older. Of course, for the kids, parents will decide, but for adults, if you're on the fence about the vaccine, let me reassure you, almost 170 million Americans have taken it. Vaccine is safe. I've taken it. I've got only one head, no two heads coming out, okay? So things are okay. We're okay. I took it back in December, January. I'm fine. The second dose got me a fever. Well, good. My body responded to the vaccine. But people had varying side effects. Some had a little bit more rigorous response and some had a less rigorous response. But all of us who have kids, we know when we take them into the pediatrician for their shots, invariably they get a fever. That's good. Their body's responding to those shots. So do not be afraid of the side effects. Let's get vaccinated. That's a sure shot way to not have to worry about variants and all these other things that are coming. But if you're not vaccinated, there are still things you can do. Of course, you're leaving the biggest tool on the table, vaccination. But let's say for whatever reason you're not taking it right now, there are things you can do to avoid getting infected with the Delta variant of COVID-19. And those things are simple. And I know these can be pretty politically charged if you're on one side of the fence or the other. But the easiest thing is let's all wear a mask, okay? When the surge is on, let's everybody wear a mask because it is a great source control strategy. You don't know who's ill or not. I have a mild allergic cough, but I didn't go get tested every day that is it COVID or not. I just pop an allergy pill and I'm okay. Well, I could be wrong. I could have COVID and not know about it. So if I continue to wear a mask, I'm protecting my coworkers, family members, and others from getting COVID. And then if I'm in a meeting or a gathering where somebody else has COVID, that mask does give me some protection of getting infected with COVID. Because it does spread with human to human, in-person contact, with droplet spread and all those type of things with the virus particles. So those are two easy things. And then a little bit of a behavior change. Let's avoid unnecessary large crowds. When things are low, cases are low, that's okay. But now cases are surging. We have a lot of spread of COVID happening in our community. So let's avoid unnecessary, that's a big word, unnecessary large crowds. I'm not saying don't go to school, don't go to work, okay? Life has to move on. But let's not go to Lollapalooza. That happened in Chicago. See what I'm saying? Those type of things we can avoid. And that way we can prevent COVID from surging again in the community and us being caught up in it. So those are the key three messages. Get vaccinated, wear your mask, avoid unnecessary large gathering.
I mean, I would absolutely concur with that. I mean, vaccination is what got us down to where we were in May by getting a large percentage of the population with protective antibodies on board. What we're seeing now is totally driven by unvaccinated individuals. So 99% of our hospitalized patients are unvaccinated. And the state just released some data just last week from February 8th to July 14th. 95% of individuals that died from COVID were unvaccinated. And of the 43 that were fully vaccinated and that passed away, 95% were greater than 65 years of age, and the majority of those were white males. So vaccines absolutely provide protection. And when you look at the bigger global picture in the United States, the death rate from COVID amongst vaccinated individuals is 0.001%. Now, the treatment of Delta is exactly the same. We don't do anything different, but the problem is we don't have home run drugs for the treatment that will rapidly reverse the course. We have monoclonal antibodies, so that is certainly helpful if you were first diagnosed and you're a high risk individual. But we also know over the past 18 months that there are people that don't have the traditional risk factors, but their genetic makeup and how they respond to the virus makes them much sicker and have much worse outcomes than other individuals that may have risk factors. So we can't always predict, but majority of what we're seeing right now is unvaccinated individuals. And I would say 35 to 45 years old is really the main number of what we're seeing in the hospital. Of course, it spans, we have older, elderly people that have not been vaccinated or younger people. And if you had COVID more than a year ago, that doesn't necessarily mean you still have protective antibodies. So unlike the original SARS, where people had antibodies for up to 12 years later, majority of people probably lose protective antibodies within 6 months with this strain. And so, even if you had it before, I really strongly encourage you to get vaccinated because that's the best way you can protect yourself.
Okay, next question. Just, what are the specific protocols if you are not vaccinated? Adult, you've chosen not to have one for whatever reason, or you're 7 years old and you can't have one. If you're not vaccinated and you have a known exposure to COVID, what should you do? And this is particularly interesting, I think, for us who have kids under 12 years old, and there are COVID exposures that may occur at school. What are the protocols that we do in this situation?
Yes. So there's the science that I'm going to explain. And then there's all these other things, what we can or can't do in variety of settings due to various things that happen. So the science is pretty clear. If you are an unvaccinated individual, for whatever reason, whether you're an adult or a child, and you have a known exposure to a COVID case, and the exposure is defined as close contact within 6 feet and more than 15 minutes cumulatively over a 24-hour period. So in a school setting, for example, your classmate had COVID and they were sitting the next seat over. 2 days later, you found out, that child's out sick and this other child had COVID. Yes, you're exposed. Probably that entire classroom is exposed because they mix and mingle a lot. So what should you do? A unvaccinated child should isolate, and the science is very true, should isolate for 14 days at home, as much limited exposure to other family members as possible, and stay in your own room if possible with room service, okay? A lot of Netflix and a lot of good food. And the idea is in 14 days, that's the full incubation period of the virus. We will know whether that child is going to develop COVID or not. And similar stuff would apply for adults in a work setting or other exposure setting. 14 days is where at the end of that, we know for sure, and the risk coming out after that is like pretty much close to zero, that once you clear the 14 days, you're not going to go back to work and have COVID again and cause problems for other coworkers or schoolmates. Now, there was a lot of studies done last year because 14 days is a long time. A lot of people wanted to get back early. People wanted to go to school early. Parents had issues keeping kids home for that long. So CDC did come out with some studies to show what can be done to reduce that, isolation period. and what risk remains after that. So a safer approach is 10 days of isolation. It leaves some risk at the bottom. I believe it's like 4 to 6% risk that after 10 days, when you return to school setting or work setting, in 4 to 6% of the situations, there may still be further spread because some of the late bloomers, so to speak, might end up with COVID on day 11, 12, 13, 14, and unbeknownst to them, spread it to others. And then there was also some push that, well, that's still too long, and why don't we include testing as an option? And there's a lot of discussion about when testing is appropriate, but it was settled that if day 5 after exposure, you get tested and you're negative, then on day 7, you're okay to resume, especially in a school setting, go back to school. But people need to understand that left about 10 to 12% risk of spread after that is done. So again, it's a calculated risk weighing against how long can you keep kids home from school, what burdens that puts on the families about, mom's got to stay home or dad's got to stay home, all those type of things. And how do you balance all of that? So the data is there. A lot of the schools were given the testing tools to deploy rapid testing. And some of them, use the 5-day test and then return on day 7 if you're negative. A lot of them stuck with the full 10 days. Again, how much risk were they willing to take in their school setting?
And I would say too, there is the variable that was with a lot of that data came from the original strain, the alpha strain. And with the Delta variant, we know that the peak viral load is higher much sooner. And there was some great data that came out comparing that the day that people tested positive, their viral load was almost 1,200 times higher. So, there may be a little more safety with that 5-day testing returning at 7 days just because the viral loads peak. But that's also, it's a double-edged sword in that people are more likely to be infectious before they're really symptomatic with the Delta variant compared to the original strain because the viral loads are so much higher.
I want to add here too a note from Dr. Whitworth. She also acknowledged that the CDC allowed for shorter quarantines. And this is not if you have been diagnosed with COVID. This is if you've had a known exposure and you're unvaccinated. She also said that these shorter quarantines have a bit of risk that disease could still develop after the 10 or 7-day mark. So even from a pediatric standpoint, she wanted to know that there was some increased risk with those shorter quarantine times. Is this a fair, I'm going to make an assumption here, is this a fair opinion that you might have, as I was just making notes and thinking, that it might be a good idea for moms to ask about what's the school's absentee policy and maybe virtual learning if there's going to need to be, say I have a 7-year-old kid who we don't get the COVID exposure from one of our classmates. We actually got it from, Aunt Susie when we had a birthday party, and now Aunt Susie is positive. Would it be a fair assessment that these are the kinds of questions maybe moms should be posing to their individual campuses?
Yeah, now you're getting into how to operationalize all of this scientific information into real life, right? I mean, that's what we need. Absolutely. One thing I wanted to say, and again, I'm going to give you what the science is. And again, things can get very charged, so please don't take my comments in any wrong way. We did work with our schools last year, and several of them chose the 10-day option. Some chose the 7-day option. What people overlooked very clearly was written in the CDC guidance that the 7-day option works best in communities with low spread. In communities with high spread, they strongly recommended the full 14-day isolation. Guess where we were last fall and right now? Full high spread. Okay? But I don't have control over that, and neither do you. So, we'll
I don't want to. Yeah. And also, we have a lot of different types of school choices represented here.
Absolutely.
We have way more than public school moms that are watching this. We have a lot of private schools represented. We have a lot of moms who are doing maybe co-op homeschool or university model school. So, this applies well beyond whatever ISD that you're a part of. But just as a tip for moms, okay, I have an unvaccinated kiddo, and if we do need to have like a quarantine period or an evaluation period, what am I looking at? And maybe needing to ask, the powers that be, okay, well then what are my parameters? Is there going to be a penalty if I keep my kids out for 10 days and they're not?
Very good question. So what parents should do is ask their school administrators about their school's COVID safety and reopening plan. Last year, they had plans to reopen schools in the fall, and this year they have revised plans because guidance coming from CDC has changed. Guidance coming from TEA in Texas has changed. And then there are also limitations on what can or cannot be done, especially in a public school setting under the governor's order. There's a recent order that he issued called GA 38. So people need to understand we're in a declared emergency in the state of Texas, and the governor has the sole power. Whatever he writes in his order is the law of the land right now. And there's a lot of limits, especially on governmental entities on what they can require, can't require. So especially in a public school setting, a lot of parents may ask, well, CDC said universal masking is a good thing. Well, why are you not requiring that? Well, they can't because the governor specifically prohibited governmental entities from requiring that from happening. And so what you should do is ask your school administrators what is included in the COVID safety protocol in your school and what's their plan in addressing if we go back to school in the fall and the surge is still on, and it can vary by school, right? I mean, some may have more detailed plans, some may have less detailed plans. So definitely learn. A lot of them posted on their website already. So ask about it. No harm in talking to the school boards about enforcing more educational approaches about COVID. Nobody's saying don't talk about it or don't educate about it. They're just saying don't mandate certain things. The governor's been very clear, no mandating of the vaccine, no mandating of the masks, and we're, for businesses and such, no mandating of closure of businesses and things like that. He's very pro-economy and making sure, unnecessary financial hurt doesn't occur in Texas due to reaction from the communities about COVID.
Yeah, I mean, it's clear what schools and governmental agencies are not allowed to do. So I think important questions are going to be what is going to take place within those limitations. So, it's going to be a tricky year. We're seeing RSV. I think respiratory viruses as a whole are going to be more because kids are going to be unmasked. We don't have partial immunity from, having it the year before because all those were really non-existent because of the use of masks. And so, is there going to be cohorting? Is there going to be a contact tracing, capabilities to help decide, which students need to be removed from the class or not? How quickly is that information to be disseminated to you as a parent so you're able to make a decision? Or if you're going to be out for 10 days, how are you going to be able to maintain your studies if there's going to be an online curriculum option or not? So those are great questions for you to be asking now. But also, I think it'd be good for you to have conversations with your pediatrician if you're a parent of what is the plan if you have an exposure, what's the best way to get tested, be really informed about what steps you need to take to protect your family and your loved ones.
And one thing you brought up, Dr. Youree, and again, I'm from public health, so we get calls. This is not my area of expertise about being in schools, but I can agree that in-person learning definitely is the best way to go for the kids, because the longer they're out of the school setting, the harder it is for them to reintegrate, and really they miss out on a lot. But this whole issue about online learning and virtual options being available, they're useful. But what I'm hearing from the schools is that a lot of those options and the funding was rolled back or cut away from at least from public schools, as far as I know. And so there's going to be very limited choices, and parents need to be prepared to be looking at all of the options that are there. It's not going to be like last year where, there was a case, so that case went home, and then the contact went home, and everybody was quickly able to switch to an online learning mode. Schools may have challenges doing that this year because those choices are not there. So definitely be asking your school what options are being allowed, and they can vary by school district, like I said.
Right.
So definitely learn, and then in the private school setting, they may have other choices available to you.
Yeah.
And so forth. Yeah.
I mean, the point that I really want to get across is that you really do need to, like, we can't answer those questions for you. You really do need to talk to your own personal campus. And you as a family unit also need to decide what is important to you and what are deal breakers for you. And that could vary, between family. There's all kinds of different situations, flexibility even in our own personal jobs to be able to accommodate those things. So, okay, we are running a little bit over time, and let's get to these other questions. So if you are unvaccinated and you do test positive, what are the current recommendations for quarantining and such?
So generally, it's currently still the 10-day quarantine, because this is for people to recover, okay? So you have tested positive from COVID. What we're finding is most people are recovering in about 10 days. Now, that's a pretty broad stroke. Some people are sick for weeks and they're in the hospital, and recovery is very long. And some people are like, man, I got a little cough and a fever, and next day I was fine, ready to go. But 10 days is kind of the rule of the thumb. And the other thing that a lot of physicians look for clinically, and again, the clinical picture varies a lot with COVID, but generally what they look for is, okay, if you had a fever, then the fever should have been resolved for at least 24 hours on its own, where you didn't need the fever reducing medications like Tylenol or Motrin to keep it down. So then your body's even telling you, okay, I'm ready. I've cleared, the illness, and I'm ready to go. So that's kind of general rule of thumb. Mostly you would want to talk to your physician or pediatrician in case of children on when they're ready to go. If you talk to public health, because we'll probably be calling you about contact tracing and finding out, where'd you get it? Did you attend a party? Who else is exposed and all of that? But general rule of thumb you're going to be told is about 10 days is a good recovery period. Dr. Youree, I don't know if you in clinical practice have seen other things.
No, that's exactly our recommendations is 10 days.
Yeah,
some of our patients are so sick that they go home, but they're not going to feel like socially gathering with anybody for quite some time.
Yeah, and Dr. Whitworth made a interesting comment on this as well, which applies to whether you're vaccinated or not vaccinated. And remember that she's talking about the pediatric population, is that if you have a positive COVID case, you are 12 years old or older, 12 to 92, whatever, and you are at least 88 pounds, to request information about monoclonal antibody therapy. This can be in kids who are 12 years old and older, more than 88 pounds, and that this makes a significant difference in the severity of your disease. This is a direct quote from her. We are not using enough of this, and it is very beneficial to help keep people out of the hospital. So she mentioned that, and I wanted to throw that out there because I thought that was an interesting point, maybe something we don't think about for the pediatric population.
No, I mean, I think if you've been diagnosed, the first thing you should do always is reach out to your doctor and, ask if you might qualify. They've really loosened the guidelines a lot on the monoclonal antibodies. And, certainly if you're a high risk person, then I would recommend that you try, to get access to that. A lot of the hospital systems are doing those infusions. You have to get it scheduled. You go in usually through the ER department, but then they take you to another location within the hospital adjacent to the emergency department, and you get that infusion. And it does, make a difference in terms of whether you may end up needing to be in the hospital.
Okay, so what if you are vaccinated? Do the same recommendations still apply to you if you're vaccinated? How do you keep from getting the vaccine if you have a known exposure or if you test positive? Do any of your recommendations or the protocols change because of the vaccine?
Just a little bit. And again, a lot of things are evolving as we go along, especially with the Delta variant surge. As Dr. Youree mentioned, we were dealing with a whole different kind of virus, low viral load compared to very high viral load. So things are evolving. So I want to put that in context. But generally, what we're doing is if you're vaccinated and you have an exposure at work, coworker tested positive, at school, another kid tested positive that you had close contact with, and you're vaccinated, you're still considered immune. Okay? Till last week, we were like, hey, if you don't have symptoms, don't worry about it. Last week, new guidance came out. Oh, well, let's at least get you tested about day 3 to 5 because we want to know if any breakthrough infections are happening and they're not becoming obvious with symptoms. So that's new guidance that even tested or vaccinated individuals are being recommended that after exposure between day 3 and 5, do get tested. That way, if you're a mild case and you didn't realize it, or just were asymptomatic case, we would know that information. You would know that information and take additional precautions. Very few of those are occurring, but breakthrough infections are occurring in people, and that's the logic behind why vaccinated individuals also would want to get tested. Generally, though, if you're not symptomatic, we're not asking you to not go to work or not go to school. Just wear a mask for a few days. Just overly cautious so that nothing else happens. But that's it. That's pretty much it. That's the change. If you're vaccinated, you're pretty much back to normal is kind of the theme.
Yeah, I mean, we have seen breakthrough infections. Usually what we've seen is somebody comes in for something else. I had a patient come in for a heart attack that tested positive as they're screening before they went for their cardiac catheterization, but had zero pulmonary respiratory symptoms. Their chest x-ray was completely clear. I don't think we would have ever been diagnosed had they not come in for their heart attack. And then I've had some patients that were very immunocompromised who've gotten the vaccine. And we know from the literature, particularly like in transplant patients, that they have a lower response rate than people with normal immune systems. So those are the ones that you see. It kind of alludes back to what I mentioned with the Texas data of those 43 that died that had been fully vaccinated. 95% were older than the age of 65. So they may not have had a full immune response. And we've not had discussions. There's not been guidance on boosters other than Pfizer released some data last week suggesting that those that went through the original trial that got a third dose had antibody levels specific to Delta that were 5 times higher than those that had only gotten 2 doses. So, be on the lookout. There's probably going to be guidance on that at some point about boosters, particularly as we have, new variants that arise. The great thing about these vaccines is that they can be adapted very quickly and rolled out very quickly to adjust for these. And Moderna has already had one modification. So, the longer we're in this, not just within the US, but also worldwide, this may be something that we have to kind of engage more on a regular basis, at least for a couple of years.
Okay, I also asked Dr. Whitworth about this, really tricky age group, and that would be our toddlers, our 2 and younger crowd, who, for a lot of reasons, may be spending a lot of time at daycare or preschool, Mother's Day out, have, in-home childcare, those types of things. And I asked her, with sort of this surge that we're experiencing, what parents could do to better protect that really young crowd who has no idea what a mask or a vaccine is, or even the faintest idea how to cover a cough.
Right.
And she responded to say that the most helpful thing is to speak with the daycare, the preschool, whoever that child care, if it's in-home child care, whatever that is, and find out what their plan is. What are their protocols for keeping children safe? Is the staff vaccinated? Are they able to keep the children cohorted or spread apart? Is there divisions among that? How are they handling hand washing? And how are they identifying and maybe quarantining sick kiddos? Do y'all have anything you would add to that recommendation?
I think those are all fair recommendations. And two things I want to point out. In this situation, parents have a lot of power. Those kids are not going to be able to follow any protocol. I mean, they're too little to even understand what's going on, right? So it's our job to protect them. And as a parent, especially when you employ in-home care, you're the employer. Well, you're not a governmental entity. You can ask, hey, are you vaccinated? If not, if you're going to come take care of my child, get vaccinated. So that's a decision as a parent. Who are you going to expose your child to? Is that person vaccinated or not? Okay, so that's different in that scenario because you have full control over that situation. In terms of daycare settings, you can ask about their COVID safety protocols just like you would do with the schools. And I think you have a little bit more leverage there because a lot of them are private daycares. So you can ask their owners, hey, why don't you require your staff to get vaccinated? Because I'm going to have to send my child here. And a lot of these other kids, and they could come from different walks of life. You know, stuff could happen there, but at least can you make sure your staff are not bringing anything into the daycare setting? And it's a conversation. We don't need to like fight with people about all of this, but certainly have that honest conversation as a parent, maybe get a group of parents that think alike and speak with the owner of that daycare or Montessori, whatever setting you're sending your child to. And you'll probably find a lot of positive responses and a lot of planning being done in those areas. Those folks are really trying their hard to make sure they can maintain a safe business. Nobody wants their little daycare to have a COVID outbreak. So certainly they're trying really hard to make sure that people are staying safe. It is not a perfect solution, folks. Even the vaccine is not a perfect solution. It's 95% effective. That means there's 5% chance still that as long as there's a large active outbreak in our community, it can get inside daycare, schools, homes, hospitals, everywhere. So the risk is going to be there. What we can do is mitigate that risk. All of us working together, getting vaccinated, wearing masks, following the protocols, asking the tough questions, make sure that planning is in play, I think is going to limit and reduce the spread in our community.
Yeah, I would, second all of that, and not being a pediatrician, but looking at from the adult standpoint, what you can do to help protect is, as parents, be vaccinated, because that, in your immediate family, that provides in some ways a protective cocoon. And if you are a breastfeeding mother, there's studies that are coming out showing that the vaccine-derived antibodies are passed through the breast milk, so that will provide some level of protection. But then on a separate note, being a vaccinated parent also helps in that I've seen time and time again where, unvaccinated family, it craters everybody. And if both parents end up needing to be in a hospital, who wants to take how do you provide care for your children? And so it doesn't become a decision of who's the sickest goes to the hospital and the rest of us kind of suffer. That way you can stay, healthier for your child if they are sick, because again, if there's a breakthrough infection, you're much less likely to be super sick. The symptoms are to be mild. That study why the CDC changed their guidance was an outbreak that occurred in Cape Cod. But when you look at the data of those that the vaccinated people that became affected, only like 1% actually ended up in the hospital, and they weren't serious infections. So being vaccinated, it helps you be able to care for your child should they become sick.
Okay, I just have really just two more questions that I wanted to ask. We kind of touched on this a little bit, but what would your advice be for us moms? And we did kind of talk about it, but I want to And I'll add a little of what Dr. Whitworth said too. You mentioned earlier that RSV and rhinovirus is going on, and I fully anticipate, I've been an elementary school mom now for 6 years. I know when that comes around, we welcome the stomach virus and a little round of strep throat here and there. We get head colds. It just comes with school, and I anticipate more of that this year. Like, you kind of mentioned, like, what should we do? Is this a conversation we need to be having with the pediatrician? How, like, if my daughter comes home and she's got a 100.4 temp, or maybe she has a runny nose, or she has a cough, like, what advice do you have for moms to assess whether this is just really bad allergies or something as serious as RSV or COVID that is mega contagious?
Yeah, so let me answer sort of generic, and then we'll have Dr. Youree kind of get more, from what he sees in clinical practice and all that. But so RSV typically happens when school is in session, right? I mean, we see it kind of start in the fall, late fall when the weather's cold. That virus loves the cold season. And then it kind of peaks around, Christmas time and beyond, and then kind of goes away when we get into spring. I mean, it's a cold season virus around where people congregate, especially in school settings. Typical age group is 0 to 4-year-olds, very young daycare setting, early school setting, pre-K kind of deal. Yeah, can it happen in regular elementary school? It does. Can it spill over into adults? It does. Teachers get it from their kids, take it home. Grandparents get it, who are kind of after school daycare sometimes. I mean, it happens in the community. No current vaccine that I'm aware of. I know I'm sure there's some under development. And it can be serious. I mean, for most people, it is mild, just a cough and a fever kind of thing. But for a lot of kids, it can turn into a bronchiolitis and maybe a pneumonia. It does cause hospitalization in some kids, and a lot of elderly grandparents who got exposed. And sometimes the teachers are in that age group, unfortunately. So it can be pretty serious. What was interesting last year, we didn't see this virus. Pretty much it was non-existent. Why? A lot of us were staying home. A lot of us were wearing masks. So it didn't spread. And in the spring, when the mask mandates came off and people were what was called revenge travel, people got out and they're like, yes, I want to be free of COVID. Well, RSV came back hard in the southern United States. We've been going strong with this for almost 2 months, 2.5 months. So a lot of burden of disease in our pediatric population, and it's spilled over into the adult population. A lot of cases occurring with RSV. So what's the solution? I mean, and we're heading into a school season with COVID on the forefront and RSV raging in the community. What should we do? Okay, well, I'm going to sound like a broken record. Wear your mask, folks. It's as simple as that. It's a virus, spreads very similar ways, comes out in droplets. And I know it's very hard for younger kids to follow that, but if you work with your 4-year-old, 5-year-old, 6-year-old elementary kids, tell them how to wear the mask correctly and not get under peer pressure. Well, so-and-so is not wearing it, so why should I wear it? Wear it, because that child will protect themselves after they listen to their parent and practice through various social settings, walk them through what's going to happen at lunchtime, what's going to happen at recess, what's going to happen when you're out playing, and what kids may say and how do you respond to that. Make sure they're prepared with all those tools and keep their mask on. That way they're not bringing it home. They could have a younger sibling at home or an older sibling at home, grandparent that they visit. All of those folks get protected. That is the one best tool I can tell you that will work with RSV, that will work with COVID. Hand hygiene. Yes, hand sanitizers, they work, they help. But as many times a day as you can go wash your hands at the sink with running water and soap, let's do that, because those two things combined will protect against RSV and COVID. And then in case of COVID, if the child is 12 and older, let's get them vaccinated. In Tarrant County, about 28%, I have to look at the numbers again, 12 to 15-year-olds, only 28% are vaccinated, and we're going back into school in 2 weeks. So 70% of the kids in Tarrant County in that age group are eligible for vaccine, but the parents have chosen not to get them vaccinated for one reason or the other. So a little bit of a plug. I have back to school clinics happening right now. So the one big location at Ridgemar Mall, and trust me, we do 20, 30,000 vaccines in the month of August, and it's all kinds of vaccines to catch up kids for back to school. COVID vaccine is available. So if you want to go to Ridgemar Mall, we're there Monday through Friday, 9 to 6, Saturday, 9 to 2. If that's too far, we have rotating clinics available. This week, we're at Resource Connection in South Fort Worth area. Next week, we're going to be at the Arlington Public Health Clinic on Randall Mill and Division Street and Randall Mill, I think, in that area. And then the following we'll be in Watauga Clinic. That's a public health location. And the last week of August, we'll be at our Lakeworth Clinic, which is in northwestern Tarrant County. So use that opportunity. We will have all kids' vaccines available. We will have COVID vaccine available. We will even have vaccines available for adults. Some parents may not have insurance, and they may not be able to afford vaccines. We have adult safety net vaccines available for them. So all kinds of choices, and you don't have to come to us. You can go to a pharmacy, you can go to a pediatrician. If you have all those things available to you, utilize it because it will help you have a safer back to school season.
I'll interject also what Dr. Whitworth said, and then Bryan, if you have something to add to that. She is speaking for the pediatric population again. She did say, even talking to your kiddos as they go to school, her recommendation was to, like you said, talk to them about importance of a mask, but also talk to them about things you might not consider, like don't eat and drink after each other, don't share food and things like that with your friends. And then if you have a kiddo that comes home and they've got a runny nose, a fever, a sore throat, etc., her recommendation is that you keep them home from school and any activities that are around other people until you can get a good assessment of what is going on. And this is where your relationship with your pediatrician is probably going to come in, and maybe just some good old mom research. We're great at researching where our kids have been and what they have been exposed to. And using, kind of those skills, and then just following the protocols that we've talked about. If you're vaccinated or not vaccinated, how you need to quarantine, and those types of things. Bryan, would you add anything to that?
No, I mean, I just reiterate, I think this fall is going to be tricky between the other respiratory viruses. We still don't know, flu wasn't around last year because of masks and there wasn't international travel. Flu migrates from southern hemisphere to the northern hemisphere and back again. And so when all that got cut down, that kind of really made flu disappear. And so we don't know what's going to happen after we had a year with no flu and now we have travel again and masks are off. And so it's going to be tricky to try to decipher between what this really is. Is it COVID? Is it influenza? Is it RSV? And that's going to make it, especially hard for our educators. I really applaud them. I mean, they did an amazing job last year keeping our kids safe. If, you don't believe masks, don't work, ask your pediatrician how much, group A strep or strep throat or diarrheal illnesses or RSV that they saw last year in kids that were in person. And masks are annoying. I wear a mask 12, 13 hours, 14 hours a day, almost every day of the week, and it is annoying. But I saw kids just be really resilient with that and rising to the occasion, and they never really grumbled about it much or anything. And so, if right now, that's probably until, vaccinations widely available or we see the rate of transmission in the community decline, that's kind of the best option that we have outside of, again, cohorting and good hand washing.
Yeah, I think those are all great points. And I want to share a couple of things. If you ever follow Cook Children's, I know they're, the pediatric hospital in the area. A lot of parents follow them, some don't. But they have this Cook Children's Checkup Newsroom. Various physicians put out articles through there or little video snippets. Two of them caught my attention recently. One is with pediatrician Dr. Diane Shares. And she posted something on July 22nd, so a couple of weeks ago, should my child wear a mask to school this fall? And it's on the Checkup Newsroom website. So if you want to look at that, great article, goes through all the pros and cons and how to navigate this environment of kids going back to school with masks. And it being a choice, right? Some kids are not going to wear it and some are going to wear it. So what are the benefits? What are the pitfalls? How do you go through all of that? And then the other thing was on July 27th, they did release, Cook Children's released a 10-point guide for safely reopening schools. Again, it's on the Checkup Newsroom website. And Dr. Mark Mazadeh, I think, he's the Director of Infection Control and Prevention at Cook Children's Medical Center. So he has a nice article and a very good video interview, so to speak. Takes about 10 minutes. I think it's well worth parents' time to listen to both of those folks and see what you can learn out of that, because those are real life tips they gave about how to get back to school safely this year.
Yeah, we will even we'll find those and put those links in the comments. Okay, last type of thing, and this is gonna be a question for you, Vinny. Do you know how are schools going to be required to report cases this year to parents, or how is that reporting going to be available to parents, maybe through the Tarrant County Public Health Department?
So I'm not sure that they're going to be required to report to parents, because the reporting requirements are to report to public health. But how do you do the contact tracing piece if you don't inform the parents that there was a case? Now, to prevent, privacy and all those type of things, HIPAA violations and all, they usually won't say, oh yeah, Vinny's son had COVID and now we're checking up on all the friends. They won't do that. But I do expect that there will be some kind of a protocol. It will be a little modified this year because of all the regulation changes that TEA put forth after the governor's orders and all that. So the best thing would be to ask your school about what their plans are for doing that. Are they going to be doing contact tracing? Are they going to be isolating kids that are exposed, not ill with COVID? And how will they notify parents that their child is in a list of kids that are exposed? All great questions to ask your school, because it's going to vary by different schools. Generally, the principles haven't changed. If the child is exposed, other kids are around them, one person's positive, the other ones are exposed, they should isolate. But things are changing a little due to guidance and regulations, and then also vaccination status, right? If you're vaccinated, you really don't need to miss school if you're not showing any symptoms. You're good to go. If you're not vaccinated, there's a little bit of a struggle there, but let's see what options are there.
Okay, we have some information here we're going to put up on the screen. We'll also include it in our description. So if people want to follow the Tarrant County Public Health, there is your @ sign right there to find out more information about those back to school, like vaccination spots. But also y'all publish daily statistics of what is happening with the coronavirus here in Tarrant County. You can find that at the website listed there. Again, we'll list these in the comments so it's easily clickable. But all that information, and you'll have a ton of it, we can access at those two spots. Also, we have information for the Texas Center for Infectious Disease Associates, where Bryan Youree works as a part of. They also have a really good social media platform at TXCIDA on Facebook, and they often are giving very kind of science-based fact-based updates on what is pertinent and happening locally within the North Texas area. So I would completely recommend following both of those. They've been super helpful as we've kind of navigated the pandemic. Okay, so last call, we're gonna wrap it up. We've gone a little over time. I'm sorry, but it was so good. Is there any last bit of information or anything you want to throw out there to the moms to be helpful to them as they are making different decisions?
Yeah, I do want to say, again, of course, I'll reiterate the 3 key messages. If your child is eligible to get vaccinated, learn about the vaccine. Let's get you armed with facts and get your child vaccinated. And then, of course, avoid large crowds that are not necessary. If they're going to school, make sure they're wearing a mask. But the other message is things are different than last year. COVID is different than last year, but also the state requirements and regulations coming through TEA to schools are very different. The options are different. So don't get caught that, oh, it's going to be like last year. There's quite a bit of difference in choices. Learn now. Ask your school administrators, superintendents, and principals, what are the plans for COVID? And if you don't like the plan, don't yell at them, please. They don't have it in their power to make that change. Talk to your school boards, and they can communicate with TEA about what they're hearing from the parents. But get educated. The choices are limited, but they're still there. There's a website. The TEA has a Texas Virtual School Network. If you feel that your child is not of the appropriate age, at least through those virtual school choices, there's very few. But third grade onwards, kids have the ability to enroll in an online school, but it comes with a lot of different challenges. I mean, younger kids, third grade, I have a fifth grader. I don't know that I can just leave her alone by herself saying, go study. So my wife's having to stay home. I have 3 kids, and that puts a lot of burden on her and on the finances. And, you're alone with 3 kids. That can be a challenge. I mean, moms will tell me, at least I get to escape to the office sometimes, but they have no escape. So be very, very armed with facts. And that's when you can go talk to the school boards about what you think is happening appropriately and what's not. Give them the facts, give them the education that you found, and then let's see what options are there. Again, there are very limited choices. The rules are set by the governor, and then all the other agencies are having to follow all of that. But let's work together. Things that are in our hand are getting vaccinated, wearing the mask, and avoiding large crowds. Let's do that.
Yeah, I would just reiterate, control the things that you can. You can control, vaccination has been shown to dramatically decrease your risk of ending up in the hospital with COVID. And for those that you can't, just be educated about what those policies are. And we're in an emergency, emergency preparedness, whether it's, whatever disaster it may be. What is your plan if this hits home with you? So what is the backup plan if you have to quarantine? What is, whether it be getting the learning materials for your child, who's going to provide care, because again, there's so many dual working families or a single parent family. How do you navigate that? And so that's going to continue to be a problem, I think, in the fall as we deal with all these different respiratory viruses where you can't really differentiate right away which one you're dealing with. So I think there's going to be a lot of bumps and hiccups along the way. And my heart goes out to the educators and administrators of schools of, this is not going to be a fun fall, I'm afraid, just with all the things that are going to have to be navigating.
Thank you too so very much. This is very informative. I am looking at the comments and I'm seeing a lot of thank yous, and the information was very, very helpful. The moral of the story is that moms may need to get to planning, and we are excellent at that. We're sorry to all the pediatricians that are about to be inundated with messages, right? We're going to talk to our pediatricians about what our game plan should be for the fall. And also to all the principals, we are sorry you're about to get a lot of emails as well about protocols and questions. And thank you to Dr. Whitworth, who did answer and couldn't be with us. I will say that we are going to actually post a written article that will list some of these recommendations, what the guidance is. We will have links to all of the articles that we mentioned in here. The back to school vaccine clinics, we'll link to that. We'll have it all curated and gathered in one place on fwmoms.com. Also, I wanted to mention that we have another Fort Worth Moms hosted panel that we did a couple of months ago where we talked with experts about children and mental health issues. And that's a very pertinent thing right now. That's kind of gone hand in hand with the pandemic. And some kiddos may be feeling a lot of anxiety and worry about going into a new school year. And things are changing again. There's been so much changing for them. So we'll post a link on that too. That was really helpful about how to identify mental health issues in your kids and how to get them help. So again, Vinny, Bryan, I'm sorry we went over, but thank you. The information was excellent. All right, bye friends.
Bye. Thank you for the opportunity. Bye.
Yes, thank you.